Hi, I'm Kerry Grinkmeyer. I'm the host of Best of Us Investors and the tribe leader of the Best of Us Investors tribe on Patreon Discord. I spent this weekend, 4th of July weekend, doing a lot of research on stocks that I want to purchase. I had sold my Facebook earlier this month and freed up some cash. And so I'm looking for other opportunities that I think are going to be greater than Facebook. And I focused on two. And one of them is Oracle, because as it said in the thumbnail, I think they are a major player in the future of healthcare. And the other is SpaceX. And I think SpaceX is a big player in the future of space travel. I did a video on SpaceX back on June the 18th. You might remember this thumbnail. Now, you can't buy SpaceX at your brokerage. You got to buy it on the secondary market, and I access that through Disruptor. Go back to that video, and you'll see exactly what I'm talking about. And later in this video, I'm going to share with you how I'm going to go about buying this, and I'm even going to do a video next week on where I go to the Disruptor app and make the purchase, and we'll talk about that in a bit. But what this video is really about is my discovery of what Oracle is going to be doing that is extremely important to me. It's something I've been talking about bringing all of our medical data together and making it available to wherever we want to make it available. And we're going to talk about that in this video because I think it's a major change in the healthcare system. And I think Larry Ellison has taken a major step. And I'm going to share with you an interview with Larry that will give you even more insight. So that's what this video is about. It's certainly not financial advice. It's financial education. I'm educating you on what I've learned, not only in the last weekend, but over the last 77 years. So stick with me and subscribe and give it a like. And then I'm going to be asking you to make a specific comment a little bit later. To emphasize the importance of what Larry Ellison and Oracle are doing, I want to tell you a story. And I want that story to be about Nita and I. Nita is my wife. We've been married, I guess, some 60-some years. It'll come this November. And between the two of us, we have lived in 7 states. We figure that our medical data is spread somewhere amongst some probably 20 hospitals across the country. And the reality is no one has access to that as a whole, yet in parts it's all available. Well, our story is we went to a wedding in Cleveland for our daughter-in-law's brother. And at that wedding, as we were traveling to Cleveland, we got hit by a semi-truck. And it threw us into a bridge, which then flipped the car over into the median. And we were both unconscious, and we were picked up by ambulances and taken to the Cleveland Clinic. As we got there, Cleveland Clinic had our IDs, which we had on us, so they knew who we were, and they had the ability to search us and find that whatever the bill was, we could afford to pay it because they could access the National Credit Bureau and search my Nita and I's credit. But they could not find our data on our health care. They could not access the data that some 7 different hospitals and 20 other medical facilities around the country had on us. They didn't know that I was allergic to a specific painkiller, and if they put it in me, I will die from anabolic shock. They didn't know that Nita is also allergic. So they didn't know that she has had brain surgery and that she has a non-malignant tumor tumor in her head or that she has metal in various parts of her body from other surgeries that they had. They didn't know that, and yet they knew my net worth. But they did not know anything about our health care. So they're there, not even knowing who to contact, who our primary doctor was, and they're challenged to take care of us. That's the world we live in today. You get away from your primary hospital, particularly if you're unconscious, and you might as well be buying a coffin, because they don't know what to do with you, because they don't know anything about you, because they don't have your health care records. Well, Larry has recognized that. Larry's not as old as me, but I think it has something to do with his age, that he's recognized this is a fallacy in the system. Yet I've been talking about this for probably 2 years. Larry has the wherewithal, being about the 4th, 5th, 10th wealthiest man in the world, as the owner and founder of Oracle, and being in the software business and the data management business, he went out and he bought a little company by the name of Centra, Centra. Bought it back in February. They closed the deal for $28 billion. Now, what is Centra going to do? Centra is a company that is basically organizing the thousands of medical facilities, particularly hospitals around the world, to get them to bring their data together. There are multiple medical data management systems throughout the country. Congress has passed a bill back in 2021 that allows this to happen. But it is Larry who's making it happen, and he's doing it with the assistance of Centra. Centra is going to create a national database under Centra Millennium so that your data and my data can be accessed not only as we give hospitals or emergency situations access to do it, but to do it autonomously. That is to say that medical facilities around the world will be able to access our data and not know it's our specific data, such that they can learn from our health care and then apply it in diagnosis and treatment of other people's health care. This is something I've been beating on this desk for the last 2 years, telling you that this was going to happen. Now, how did I become aware of this? I basically was sent an email from one of my tribe members, someone who comes to my Discord and participates in my Friday stock talks, and said, Kerry, you've been talking about this for 2 years now, and I discovered this article that you need to read, that Oracle is going to implement what you've been preaching about for 2 years. So I want you to see my research. I also then went and found a interview with Larry where out of his words, he will explain that to you. So I want you to have access to that interview. I want you to have access to my research, the article that was sent to me. And so I'm going to put a link in my description that is going to give you a link to a download that I will send you, and you will have all this, all that I have, that is enough today to cause me to want to buy Oracle stock. I want to own some of this, and I will build in my ownership. It's trading right now for about $70 a share. It's been substantially higher, and we are at an advantage right now in that the market is depressed, and we have an opportunity to buy into the most important change in our healthcare world, and part of it is going to be as a result of Oracle and Centra's coming together. And then having a driving force like Larry Ellison, who is aging and understands the importance of this. Now, The other stock I told you I was going to buy is that of SpaceX. As I said, I did this video on June the 18th where I explained how you can buy it through the secondary market and how I can access that secondary market through Disruptor. What I want to know from you is how many shares do you think I should buy? That's right. I want you to go into the comments and tell me, SpaceX, how many shares, put a number next to it. And that's going to give me some guidance and get you involved in it as well. Now, if you would like to explore this Disruptor app before I go on and buy it so that you have an understanding of what it's all about and how safe it is and what their fees and costs are, I'll put a link to that app as well in the description. So that's where I'm at. I am buying into what I think is one of the biggest changes in healthcare, one of the most important. And I have said this so many times. I'm 77 and 3/4 years old. I believe the most important event that happened in my 77 and 3/4 years was the coronavirus, because it alerted the world that our healthcare system is broken, all the way down to if I do, in fact, get in a automobile accidents in Cleveland. Let me share with you, that is a story. It's not true, and it is certainly not a death wish that Nita and I have. But I think it illustrates the importance of what needs to happen. And then when you put to that artificial intelligence, that we take all of our data and compare it, again, not with our names on it. I think the word is autonomously. No, that's... Anyway, it won't have our names on it, so it will create the ability for artificial intelligence to scan and to analyze our healthcare so it can improve the healthcare of the world. This is huge. What is the financial reward from it? I'm not sure. But I believe it's something that every hospital, every healthcare facility, every emergency facility, any ambulance, and any police officer, whatever, is going to want to have access to it. So that if they know who you are, and particularly if you can give them permission, they can find out that if you give me a leave, it'll kill me. I'll go into anabolic shock, my tongue will swell, and I'll suffocate. But in Cleveland Clinic, they didn't know that. And they could inadvertently kill me or you without the knowledge, the data. The wonderful thing is the world's about to change in so many ways. And you're in an opportune position to take advantage of it. If this is the kind of information you want, if you would rather not hear about what interest rates are going to do to your favorite stocks over the next 3 weeks, you'd rather look into the future and find visionaries like Larry Ellison and like Elon Musk who are thinking about improving our healthcare system and taking us to Mars and reducing the cost of firing rockets up into space and putting satellites so that we have better internet service. If that's the kind of thing you'd like to be a part of, just subscribe, give me a thumbs up, leave a good comment. Ignore the spam. Ignore those financial advisors who are throwing garbage on my website to try to promote themselves free. That should give you some real judgment as to who they are and what they're all about. And if you're doing it, understand what you're doing to yourself. All right, that's my knowledge for the day. That's my sharing for the day. And let's get together and take a look. Remember, tell me how many shares of SpaceX I should be buying.